What does your DEXA scan Z-score mean for osteoporosis? Have you ever wondered what your DEXA scan Z-score means for your bone health? A DEXA scan, or dual energy X-ray absorptiometry scan, measures your bone mineral density. The Z-score specifically compares your bone density to what is expected for someone of your same age, sex, and body size. This comparison helps to determine if your bone density is lower than what is typical for your demographic group. If your Z-score is -2.0 or lower, it suggests that your bone density is below the expected range for your age. This could indicate secondary osteoporosis, which means that your bone loss might be due to factors beyond normal aging. These factors could include certain medications, diseases, or other clinical conditions. In such cases, further medical evaluation is recommended to identify any underlying causes. On the other hand, if your Z-score is above -2.0, it generally means that your bone density falls within the normal range for your age group. However, it is important to note that, especially in older adults, a normal Z-score does not completely rule out osteoporosis. Bone density naturally declines with age, so other assessments may still be necessary. Z-scores are particularly useful for children, teenagers, premenopausal women, and men under 50 years old. In these groups, Z-scores help identify abnormal bone density compared to peers, guiding diagnosis and management of osteoporosis or other bone disorders. For postmenopausal women and men over 50, the DEXA scan typically reports a T-score instead. The T-score compares bone density to that of a young healthy adult and is the main diagnostic tool for osteoporosis in these populations. A low Z-score can prompt further investigation to find treatable causes of bone loss, such as hormonal imbalances or nutritional deficiencies. While a Z-score does not diagnose osteoporosis on its own, it signals that your bone health may be compromised beyond what is expected with aging. Interpreting Z-scores should be done alongside clinical factors, including your fracture history and other risk assessments. It is also important to remember that small variations in scores can occur due to technical factors, so consistent testing methods are recommended for accurate monitoring. In summary, your DEXA scan Z-score provides valuable insight into how your bone density compares to others in your age group. It helps identify if you have unusually low bone density that may require further evaluation for secondary causes of osteoporosis. Always discuss your DEXA results with a healthcare professional to understand what they mean for your individual bone health and fracture risk.